Welcome, Jephthah.
Hi, Rory. How you doing?
Great. And yourself?
I'm very fine, thank you.
Excellent. So, um, your your talk was about from physical to digital, and it's creating an effective user journey for health. I
Yeah,
I've looked at some of the feedback from people as well, and very highly regarded talk, like very well received, and I thought it was great as well. So, thank you very much for sharing.
thank you so much.
Um, So I want to jump in with a few kind of questions about the product and how you went about it. Um, so did did you? I guess one of the problems that people always have is they think I don't have this amazing idea. So I'm just curious, did your company invent the tests and the kind of the treatments, or were you just finding an innovative way to market and get them out there to people?
So the crazy thing is, those things were already available. Um, the rapid diagnosis test kits have been around for years. Pharmacists have been in existence for years of years in Nigeria, but nobody just thought about linking the treatment procedure to these already existing channels to make it way more effective, and that was the opportunity we saw. I'll give you a little bit of a background story. The founder of Wella is a medical doctor that was working in Northern Ireland in Nigeria. So he came to the country and realized that malaria was killing so many people, and he wanted to do more. So that was when the idea around, okay, how can we try as much as possible to allow people to be able to access treatment. In fact, the main goal was for us to just reduce the cost of treatment, not to change the way people were accessing treatment. So we're not really thinking around leveraging pharmacies and all. But by the time we did our user research and we spoke with a lot of people, we realized that, like I said in the talk, virtually everybody that we spoke to visits a pharmacist before they go to the hospital. So it was an established user
Yeah.
behavior that we felt like, okay, rather than change this user behavior, why don't you build on what's already existing? And that was what literally led to our main beachhead strategy at launching Wella Health.
Excellent. I love the idea of just piggyback on top of something that's already there, but making it better. So in line with that of kind of there was already a habit or a practice of people going to pharmacists. You mentioned that one of the challenges that you had, and thank you for sharing the challenges as well, because often a lot of people just give this story that everything worked out perfectly when it never does. But you mentioned that it was difficult to get some of the pharmacists on board. So what were the key challenges that you had there? And then how did you as a team kind of figure out their needs and get them aligned?
Right. So not that there were too many secrets about what happens in Nigeria health space, but pharmacists are not really regarded as primary points for a care in Nigeria. There's this big disparity between, should a pharmacist actually take care of people versus should people go to the hospital? So it was imperative that we try as much as possible to one, educate people, and also speak with the pharmacists to engage us. Then there comes the point of payment now. I mean, we are coming to you and saying people are going to just be paying us 450 naira, which is less than $1 every month, to be able to access care that is about 5,000 naira. So there was that challenge of, how will you guys manage these? Where will the money come from? Are you an NGO? No, we are for profits. We are not an NGO. But we definitely had to find a way to, speak with them and engage them more. Then the other thing we did was we made pharmacists and partners. Rather than just saying we want to work with you, we changed the strategy from just working with pharmacists to actually partnering with them. And that was what led to us actually partnering with the Association of Community Pharmacists in Nigeria, which are now like a main partner of Wella Health. And also we started creating tools that help pharmacists to be able to like better their operations to make it more effective and faster. So other than just them helping us with treatment now, they have tools that allow them to be able to do patient follow-up, which was created by us. We now give them access to loans from our own side. They have wallet system that allow them to be able to collect payments. Now we are doing way more businesses with them rather than what we started with initially. So because of those value-added propositions and other things that were available, it became easier to convince them to get on the train with us.
Great. No, I love that kind of leading by just demonstrating value. One question, and you brought it up there, that what you're asking for per month is quite low, and the treatments are quite expensive. So, from your perspective, are you one of these Silicon Valley companies that doesn't make any money and is hoping eventually down the line that you'll make some, or are you actually profitable at this point, or do you need to grow to a certain stage to get to that profitability point?
Our goal is to be profitable. So the first thing is, there's usually this confusion that we are an insurance company now. So Wellite is not an insurance company. What we do is we work with insurers to create technology-driven solution that allows people to be able to access insurance in bite size, right? So we do not actually own the insurance that we give to people. Rather, we work with insurers. So ours is to develop a technology system that allows this to be distributed to people, provide a channel for people to be able to access those micro insurance plans that have been created by these bigger insurance companies. But as we go on, we're starting to realize that there are way more opportunities around the business, which is part of, putting your heads down and seeing what is already available and trying to build on what is available. So we now have way more different kind of offerings. Aside from the insurance now, we've like I said in the talk, we've now pivoted into doing pharmacy benefits management with this insurance. So our network of pharmacies now and our patients now have access to drugs even cheaper at the regular rate that they would have normally have access to it when they go to pharmacies, because we started seeing those kind of opportunities available. And we're gradually getting to the point where we'll be very profitable, but not right now.
Excellent. No, they always talk about have a mission behind your company that will get people really excited. And to be honest, the mission behind Wella Health does sound really exciting.
Yeah.
So that's great. In terms of what you've done, is there anything for the people who aren't insured? So let's say somebody finds, I guess it's a twofold question. Can they just go to the pharmacy and take advantage of all the work that you've done setting up the pharmacists, or do they have to be a part of Wella? And
Yes.
the second part is, can they turn up that day and join as they know that they're
right? So that's a very good question, but I'll share a story with you. I like to tell stories. So we recently started working at Ikotekpene. Ikotekpene is a small town in the eastern part of Nigeria, and we got over 2,000 subscribers from there. But over 90% of those subscribers are first-time subscribers. They've never had any form of insurance before. So meeting Wellite was like the first time they actually have access to a plan. So what we did was we allowed them to be able to get access to the service at the point of sale. So we partner with pharmacies in Ikotekpene. When people walk in and want to treat malaria, rather than spend 5,000 naira on treatments, subscribe to our plan for the next 3 months. It's just 2,400 naira for the next 3 months. Why don't you subscribe to our plan and you have access to your treatment for the next 3 months, rather than spending this large amount of money? And that made it easy for us to onboard more people. And I mean, the news spread like wildfire in the town. And now we have an experience center there. We have to actually build a physical center there for people to be able to have access directly to us. So yeah, people sometimes walk into the pharmacy and experience Wella Health for the first time, and they keep going. But it's impossible for you to not subscribe and get access to our care. But now we actually are thinking around this, and we're now building a community that allows people to be able to actually speak with doctors, to have access to health information, and from there, hopefully, they can get onboarded onto our platform.
Great. Well, thanks very much for your time. To summarize, I love the approach of go in with a niche and then expand, rather than like the people who try to build the everything product. It was a great idea to kind of start, and I loved how you explained the user journey in your talk. So if anybody hasn't watched it, I'd advise you to go watch it now.